This is a bit of an update on what I've learned from the MS Academy webinars. So like everyone here, this pandemic has hit me like a steam train, and I had a lot of questions that I wasn't really getting answered by conventional channels. I didn't really understand how a virus that only recently had been reported to travel from person to person in China in a few months, it could get everywhere. And then I needed to know some practical things. How did I try and keep the multiple sclerosis service doing? What do I do about disease modifying therapies? And what do I do when I'm in clinic or start talking to people over the phone? What do I tell them to do? And there's no book that can help us. There's no multiple sclerosis management for dummies, and there's certainly no multiple sclerosis management during an unprecedented pandemic for dummies. And this is what we used to do. We used to meet up in these big rooms, all of us together, and we talked to one another about what we were doing. And we could no longer do that. But actually, one of the unexpected paradoxes of the pandemic is I think it's probably brought us closer together. And there's never been more opportunity for peer-to-peer learning through technology. And this is the link to the Multiple Sclerosis Academy webinars. And if you haven't had a chance to have a look at these, I'd really recommend having a look at some. And I've watched them all. There's about 14 hours worth. I've sat through all of that. And I'm just going to give you a little guide to some of my highlights from that 14 hours. So how did it get so bad? How did it spread so rapidly? We knew this was a highly infectious disease, but it started out in a medium-sized city in China. Why is it now everywhere? Well, Gavin's inaugural lecture really highlighted this to me. When I think of sort of large gatherings of people, I often think of the Hajj pilgrimage, where 2.5 million people get together from all around the world on Mecca, and those huge crowds and the huge intermingling that you see. But his webinar made the point that this is tiny compared to the Chinese New Year, which coincided with the outset of this pandemic, where about 400 million Chinese people tend to return to their family home, often traveling very large distances via air, and then travel back to their cities. And unfortunately, this coincided with the outset of this pandemic, and is certainly why it spread globally and so rapidly. He also talked about how we tried to keep the MS service going, and these changes are long overdue. He presented this picture here, which is the Manchester Royal Infirmary, I think in about the 1930s, around the time of the birth of the NHS. And I trained in Manchester, and it doesn't look that different now, only that they have slightly nicer chairs. But prior to the pandemic, we were bringing people into hospital, and there are other ways of doing this. There's different models. We need to be in a different place, and that has to be online. But that also brings open opportunities for non-asynchronous consultations. And his presentation was an excellent guide to that. All of this I found to be rather unsettling and unfamiliar. And this is an excellent webinar to allay some of these fears. And one of the strengths of the MS Academy is that we have a very diverse geographical spread. And the Academy was able to get the opinions from people who've been doing this already for other reasons, for logistical reasons in Scotland and in Cornwall. I found this webinar to be incredibly reassuring and interesting, particularly that rather than being a necessary step to keeping the service going, that we could actually make this a positive thing and really use technology to enhance the patient experience, which they've been able to do in Scotland and in Cornwall by the use of video consultations. Next, what do I do about all the people on disease-modifying therapies? And this webinar is a really good introduction to the early set of the ABN guidance. And as we talked about today, they've sort of largely split into two, into the drugs that you can continue with lower moderate risk categories, and the drugs that you must temporarily suspend and delay in the intermediate to high risk category. This also brought up the issue of NHS England slightly relaxing the rules for the use of natalizumab, meaning that we could use it in people with highly active disease, so in people just with one relapse despite the use of a disease-modifying therapy, and prior you had to have two disabling relapses. It also discussed extended interval dosing, extending the dose out to about six weeks, which I think a lot of centres have adopted, us included, and presented this rather reassuring assessment from about 1,500 people on multiple sclerosis treatment, showing no clear change in the rate of no evidence of disease activity with an extended interval dosing, perhaps even slightly better with the extended interval dosing. I'm not quite sure where that is. If you're interested in the detailed immunobiology of the epidemic, you should do this webcast by Shamali Napavan. And one of the really interesting things that she showed is that there is an association between the degree of lymphopenia and the extent of other problems in coronavirus, which is relevant to our disease-modifying therapies. This is a fantastic debate between Klaus Schreiner and David Baker. And then they again made this point that the more lymphopenic that you were, the more that you, the worse that your coronavirus tended to be. But there were some caveats to this, and this may be a secondary phenomenon. Actually, coronavirus may cause your lymphocytes to go down. They also presented this slide, which is incredibly interesting. So this up here, I'll just, this here is a lung biopsy of someone who had a lung biopsy for a lung cancer and was found to have coronavirus. And what this shows is the early response to coronavirus is via the innate immune response and CD8 T cells, with antibody response being a little bit less prominent. That's relevant because in this webinar we saw that different treatments have differential effects upon the antibody response, with alemtuzumab having a really profound effect upon both elements of adaptive immunity, but also the innate immunity. Cladribine having an intermediate effect, and ocrelizumab having less effect, preserving some of the innate immunity and preserving some of the regulatory cells of the adaptive immune system. And they make the point that these aren't the same, and this is going to be really relevant, particularly following the new ABN guidance, where we're going to have to do some risk assessment of treatments and try and work out who can restart on ocrelizumab, and when we start cladribine and when we start alemtuzumab. He also showed this slide, which I found pretty reassuring, and I've shared with a number of my patients, showing a very significant reduction in the amount of ITU admission for people with severe coronavirus who are immunocompromised in this pandemic compared to other issues like with viral pneumonia and flu pandemics. And this has been incredibly reassuring to provide to some of our patients. This is all theoretical, but this webinar really updates you as to what we know so far. And this is an Italian study looking at 86 Italian centres in May and their experience of coronavirus. And this is published in the Lancet Neurology. And it's provided us, I think, with a degree of reassurance and a degree of reassurance that we can start to reconsider treatments. This is looking at all the people who died. And actually, there were no clear signs with disease-modifying therapies. And most of the people were on no therapy and had more advanced disease, which we would expect. We also got Richard Reynolds' describing the MS Societies project. This is a smaller number, but I think it's really helpful in our discussions with our patients. The first thing I took from this is that actually the signs that people with multiple sclerosis were of coronavirus that they were reporting were very similar to what we know from our day-to-day practice people with coronavirus report. This slide here shows the distribution of the drugs that people with coronavirus were on. And the main thing I took away from this is that there was nothing to take away. It seemed largely similar to the numbers of people in the general population with multiple sclerosis, and there weren't any associations between one or other drug, particularly the more highly active drugs with coronavirus. This is a rather interesting slide looking at a few associations that they've noticed. And they noted that the people who reported getting coronavirus or reported at getting coronavirus, they tended to be slightly younger, which may indicate that those are people who are mixing in the community a little bit more. We're actually more likely to have relapsing as opposed to progressive multiple sclerosis. And I think that probably relates to their exposure. And most prominently, the people who self-isolated did seem to have a very significantly reduced risk of coronavirus, which I think should be reassuring to our patients who have been asked to shield, that this really does seem to be a good intervention for them to do. Lastly, what do I tell people with MS to do? It's a terrible thing to be living under the constant threat of developing coronavirus. And it is nice to have some practical suggestions that you can get on and do rather than endlessly worry. This is a fantastic webinar which just provides some practical advice that we can distribute to our patient, so just to how to prepare in the event of getting coronavirus. This isn't a new concept. There is this concept called prehabilitation, which is used in orthopedic practice before operations, where people have got to get into their best physical fitness before they have an operation. But we can use this concept for people with MS. So making sure that people's MS is really well managed, treating low vitamin D levels, stopping smoking, care for your mental health. And also just trying to be active in whatever way that you think about. And in people with more advanced MS, just thinking about what would happen if you got coronavirus and what you would want for your treatment. For people with more advanced MS, I've shared this video with them a few times. And this is a physiotherapist showing you how to do some deep breathing exercises that you can do in your home. All of this is terrifying, and this is a really helpful session in just showing how you can manage this this extremely stressful situation. Jay Johnson, a consultant neuropsychologist, has come up with an idea of a PPE for the mind, protection for your mind, and has provided, it's an exceptional webinar with some really good suggestions. This is something that I took away, that our brains switch between two gears, a thinking gear where we analyze things and a sensing gear where we live in the moment and enjoy ourselves. Stress tends to put us more in the thinking gear where we ruminate, and it's important to learn to switch to the sensing gear, and the webinar has some really good suggestions for how you can do that. Coronavirus has been absolutely terrible and a horrendous situation, and Gavin mentioned that this is Peter Tunner, someone I met in the MS Academy and was a nice friend to me, who died of coronavirus. But it will all be over. This is Halifax Hall. Yesterday, I went past it on my run looking resplendent in the sunshine. We will all meet again, and I hope we will learn things from it and be able to improve what we do for one another and what we do for our patients. Thank you very much.